Modifiers play a crucial role in accurately describing the circumstances of procedure or service, ensuring proper reimbursement and compliance with coding guidelines. Welcome back to my YouTube channel. If you are new to my channel, welcome to MadCode Insight. Hi, I am Nashapa, a certified medical coder. Throughout this series, we will explore the various types of modifier, their significance, and practical examples to deepen your understanding. So let's embark on this journey to master the nuances of CPT modifiers together. CPT modifiers are two-digit numerical codes appended to CPT codes to provide additional information about the services rendered. They are appended to CPT codes to indicate specific circumstances that may affect reimbursement or the description of the service provided. A modifier may be appropriate when the service or procedure has both professional and technical components, was increased or reduced in comparison to what the code typically requires, provided to the patient more than once. More than one provider performed the service or procedure or location was involved. Modify 22. CPT Modifier 22 often referred to as the Increased Procedural Services Modifier. It is used to indicate that a procedure or service provided requires significantly more work, time, and complexity than usual, leading to increased reimbursement for the provider when appropriately documented and supported. Let's take an example. A patient has a colonoscopy and polyp is removed. The removal of the polyp causes excessive bleeding and an extra 30 minutes is spent controlling the bleeding. In this scenario, we will use the modifier 22 to the surgical code. Keywords used in the procedure to add modifier 22 are extended time or took longer than normal. Modifier 23. CPT modifier 23, also known as the unusual anesthesia modifier. This modifier is applied to anesthesia CPT codes to signify that the anesthesia provided required significantly more complex or challenging than usual due to unusual circumstances, leading to increased reimbursement for the anesthesia provider when properly documented and supported. Let's take an example. Alexander, an 11-year-old boy, had a superficial cut on his left cheek after being in a car accident. Doctor is ready to perform a simple repair of the wound, but she is very concerned. Alexander has a Tourette syndrome that causes him to jerk or move abruptly. Although anesthesia is not typically used for a simple repair of a superficial wound, doctor administers general anesthesia. Then the code is along with modifier 23. Keyword used in the procedure to add modifier 23 is unable to tolerate without general anesthesia, inappropriate when given for convenience. Modifier 24. CPT Modifier 24 is also known as the Unrelated Evolution and Management Service by the same physician during the post-operative period. It is used to indicate that an evolution and management service provided by the same physician during a post-operative period is unrelated to the surgery or procedure performed, which allowing a separate billing and reimbursement when appropriately documented and supported. Let's take an example. The patient is 2 weeks status post neuroplasty for carpal tunnel of the right hand and present to his surgeon today for a new complaint of the right knee swelling and pain. The appropriate coding on evolution and management code is along with 24 modifier. Keywords used to use the 24 modifiers are unrelated, outside of, not related to. Modifier 25. CPT Modifier 25 is used to indicate a significant, separately identifiable evolution in management service by the same physician on the same day as another procedure or service, allowing for separate billing and reimbursement when appropriately documented and supported. Let's take an example. A patient presents to the office for scheduled lie removal. When the patient arrives, she has cough and fever, which are evaluated and treated in addition to the scheduled procedure. Evolution and management code will be used along with 25 modifier and lying removal code. Keywords used in procedure to add modified 25 are unrelated, outside of, not related to. Modifier 26. CPT modifier 26 is used to indicate that the professional component of the service was provided by a physician, while the technical component was performed by another provider or faculty. Modifier 26 typically refer to the interpretation and supervision of a diagnostic test or procedure, such as reading and interpreting an X-ray, MRI, or pathology slide. Let's take an example. A physician ordered X-ray to a lady with complaint of limping walk. Lady go for lab test and come back with report. Physician only interpret the result of the test. Quote the professional component. In this scenario, we will use the code along with 26 modifier. Let's discuss about technical modifier. Technical modifier is used when only the technical component of the service is performed. The technical component of the service involves the performance of the test or procedure itself, including equipment, supplies, and personal necessaries to perform it. When modifier 26 is used, it signifies that the physician provided only the professional interpretation and supervision, while the technical aspect of the service was provided by another faculty, such as hospital, imaging center, or laboratory. Let's take an example. The patient of the lower back is sent to the radiologist for X-ray. The radiologist takes X-ray. These films are sent to the patient's primary care physician for interpretation and report. What code should the radiologist report? Code will be along with technical modifier. Here is a point to remember. If a physician took the X-ray in his office and also did the interpretation and report, then there will be code without any modifier. Let's get started with the question and answer session.